cancer death rates have dropped nearly a third since the 1990s. That's according to a new report published by the American Cancer Society. Cancer deaths among men and women fell around 32% from its peak in 1991 through 2019. Joining us now to further discuss this report, Dr. William Cance, a chief medical and scientific officer for the American Cancer Society. Dr. Cance, thank you so much for being with us. This is progress, but what is it that we're doing differently that's allowing people to live?
So this is progress, and it's multifactorial. So with cancer, our ultimate goal is to prevent it. If we can't prevent it, we want to detect it early. If we can't detect it early, we want effective treatments. And we've made progress across all of those areas. So the most recent drop in lung cancer, for example, has been associated with reduced smoking, better screening, and better treatments across all aspects of how we treat lung cancer, from medical oncology, radiation, and surgery.
So what cancers do we need to look out for in terms of which ones are the most deadly right now? Would breast cancer still be around the top of the list here?
Yes. So in the cancers that cause the most deaths, in women, it's lung cancer, breast cancer, colon and rectal cancer. In men, it's lung, prostate cancer, and colon and rectal cancer. So those are have the greatest numbers. Other cancers, like pancreas, is right below that in the death rate. And pancreas, some of the other rare cancers, but are very serious cancers, such as brain, esophageal, and so forth.
And for those who are watching and they have a loved one who's been going through treatments, obviously there are a variety of treatments, but can you talk about which ones are specifically showing the most promise?
Sure. So we're evolving toward what we call targeted therapies, which is basically taking an individual patient's tumor and finding out what abnormalities do you have that we can treat with a specific drug. So it's a targeted therapeutic as opposed to just a chemotherapy broadly. We're doing many more targeted therapeutics, and we're also learning how to harness the body's immune system to fight cancer through immunotherapy. And between those two, they have made a tremendous impact in reducing the death rate.
You're hearing people say that their family or friend, or you're watching social media, somebody that I know, has cancer. Doesn't sound like it is the death sentence that it once was, which is encouraging. But there are certain groups of people who are more at risk for cancer than others. Is there anything that we can do as a preventative measure, all of us, to stave off cancer?
Sure. So one of the best things to do is what we call healthy eating, active living. Eating a normal or a healthy diet, and also having activity. Activity actually can prevent cancer. We've shown that. People with cancer who are active live longer. So those are two things that can be done. The other thing that is to get screened. So I encourage people to talk to your doctor. Screenings have dropped off during the pandemic. We must get them back.
Yeah, you are absolutely right. I'm so glad you remembered to bring that point up, because we've heard from a lot of different people who have not gotten their routine screenings. And I know during the pandemic, it was important for me personally to actually get some screenings done. Thank you so much, Dr. Cance, for being with us, and appreciate your time.
Oh, you're quite welcome. Thank you.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.